Thank you and good afternoon. So today being the Tuesday after a long weekend, we have 4 periods to report on today. Between Friday and Saturday, we had 452 new cases of COVID-19 diagnosed in British Columbia. From Saturday to Sunday, an additional 431 new cases. Between Sunday and Monday, 348 people were diagnosed with COVID-19. In the last 24 hours, we've had an additional 302 new cases. That is a total of 1,533 new cases diagnosed over the long weekend, 6 of whom were epidemiologically linked. And that brings our total number of people diagnosed with COVID-19 to 74,283 in British Columbia. Of the new cases, 392 are people who reside in the Vancouver Coastal Health Region, 856 are people in Fraser Health Region, 58 people reside on Vancouver Island, 92 are in the Interior Health Region, and 135 people were diagnosed in the Northern Health Region. We now have 4,189 active cases in all health authorities in British Columbia, of whom 231 people are in hospital, 74 of whom are in critical care or ICU. And an additional 7,136 people are under active public health monitoring, and 68,705 have now fully recovered. Over this past 4 days, we've had another 26 people across British Columbia who've died from COVID-19, bringing the total number of people to 1,314. As always, we know this is such a challenging and difficult time for families, for caregivers, and for communities to lose loved ones to this virus, and our condolences are with you, and our thoughts are with you today. We have 3 new healthcare outbreaks to report today at Eden Gardens, at Wexford Creek, and at Shaughnessy Care Centre. As well, we have 3 outbreaks that have been declared over at Heritage Square, at Concord by the Sea, and Holy Family Hospital. So we now have 15 active outbreaks in long-term care and assisted living, and 6 in acute care units, involving 561 residents and 349 staff. In the community, we've had an additional outbreak declared at Timothy Christian School in Chilliwack, and we've had an outbreak as well at SFU Childcare Society. And Fraser Health is involved with investigating and managing both of those. An update today on our variants of concern. To date, we've had a total of 60 people who've been infected with variants of concern. That's 40 of the B117 associated with the UK, 19 people who've been diagnosed with the B1351 variant that's originally associated with South Africa, and 1 person, as I mentioned last week, who has the B1525 variant that's been first detected in Nigeria. And when we talked about it last week, it was one that was called a variant under investigation, as they were still discussing nationally and internationally whether there were some of the changes, the mutations that this variant had that might confer an advantage in terms of transmission. And as of today, it has been noted as a variant of concern because of some of the mutations that are involved. Since the start of our immunization program, we're now up to 171,755 doses of a vaccine that have been administered in BC, and 22,914 of those are people who received a second dose as well. As we know, the past couple of weeks have been very limited in terms of supply, and we're really pleased to say that this week deliveries of the Pfizer-BioNTech vaccine are resuming. Some has arrived already, and more will be arriving in the coming days. There has been some short delays because of weather, both in the United States and across Canada, but this is encouraging. Our supply still remains somewhat limited, and we need to continue to build up our program as more supply comes in and we have more stability in the arrival of the vaccine over the coming couple of weeks and into March. We are focused really on providing the second doses, particularly to those people who are at highest risk, which are our residents and seniors in long-term care. I know that many people have had questions about what deferring the second dose for a period of time may mean for how well the vaccine works or vaccine effectiveness. And really, we've been following this, of course, very carefully in countries that started their immunization programs ahead of us and looking at the data that's been collected from the UK, from Israel, and from here in Canada. And we have some early data from our long-term care homes here in British Columbia. We have some data that we've looked at over the weekend from Quebec, along with my colleagues. And there's evidence from the WHO and others showing that this delay of several weeks between the priming dose of these vaccines and the second dose, which is a booster dose, does not have a negative impact on vaccine effectiveness. What this means is that as our body is building up antibodies and our immune response is building after the first dose, that is sustained for a period of weeks. It may, in fact, and we know this from other vaccine programs and from how our immune system works, result in the end in a stronger and more long-lasting protection. Vaccines stimulate our immune system in several ways, but there's two main parts to our immune system that are stimulated when we receive an immunization. First, the vaccine triggers what we call antibodies, and these antibodies are the things that bind to that protein on the outside of the virus, the spike protein, and prevent it from binding to our cells and getting into our body and being able to replicate. And that is what we see first. We see these antibodies increase over a period of days to weeks after we're immunized. It's one of the things that we can measure most easily because we can measure what we call neutralizing antibodies, or the antibodies that actually affect that spike protein in the blood. And it's something that we know is a marker of how well we are protected from infection. But there's also a part of our immune system called the cellular immune system. So these are things that are cells that are in our blood, what are called B cells and T cells. And these are cells that live in our lymph node and in our blood system, and they take time to fully develop. And they also modify and they react to the things like the protein on the outside of the virus. And it's these cells that take longer to build up, but are longer lasting as well. The memory of these antigens in the T cells and B cells, our cell-mediated immunity, is what protects us over the long term. And we know from immunology, we know from other vaccine programs that having a longer interval between your priming dose and your booster dose allows those cells to develop as well, and may be the reason why we have a more longer-lasting benefit if we have a longer gap between the first and the second dose. It is still too early for us to know how long this initial immunity lasts in people, but we do know that the current vaccines are very effective, and the data from around the world shows us that this protection does last for many weeks. Here in BC, we've been monitoring residents of long-term care homes and have been connecting them to people who have developed COVID-19. And what we've seen is that in the 3 weeks after the initial vaccine in long-term care residents, the protective effect of the virus is 89%, almost 90%. So that is really good news for all of us. And it supports the fact that we have good protection even after a single dose. As a scientist and somebody who's worked in the field of vaccines for quite a long time, this is actually incredibly exciting and positive news that we have this very high level of protection in seniors here in BC from this first dose of the vaccine. And we do know that these immediate and positive results are something that we rarely see with vaccine programs. And it is good for as long as several weeks to months. So while it is important to get that second dose, and we will be focusing on doing that, especially in people who are most at risk, we are reassured that delaying that for weeks, even to months, and in the UK and in Quebec, they're looking at 90 days or 3 months for the second dose. We know we have a buffer where we can safely delay the second dose if needed to make sure that our operational issues, that enough vaccine comes to be able to provide those second doses. So that's what we'll be focusing on, and we'll be monitoring very carefully so that we can tell if we start to see a decrease in protection effects. The other thing that we have learned, of course, throughout our pandemic here in BC is that the tide can turn quickly, and that successes that we have had in getting our transmission down and preventing outbreaks can also be washed away quickly. While the overall number of new cases has slowly been coming down and is lower than it was a few weeks ago, it is still very high in terms, much higher than we want it to be. And we are also once again seeing increases in some regions more than others. Particularly, we've seen cases start to stabilize as the outbreaks have been settling down in the interior. We're still having challenging times, of course, in the north in many communities, but on the island as well, things are starting to be managed. But we are very concerned that in some of our higher population areas, particularly in the Fraser Health Region and Vancouver Coastal Health Region, we're starting to see an uptick. And what we see in terms of cases today reflects what has happened as long as 2 weeks ago. So what we've started to see in the last week is the 7-day rolling average of numbers of cases has started to creep up, particularly in Fraser Health. The percent positive, so the number of cases that we have, of number of people who've been tested and the percent who test positive, and the 7-day rolling average of that also is ticking up, particularly in Fraser Health. And the third thing that we monitor for, that we present in our modeling data, is that reproductive number. And we want it to be consistently below 1, and as far below 1 as we can get it, because that is our buffer. So that means how many people, on average, is a single case transmitting to. And if it's above 1, we know that that means growth can happen very quickly. And in the last week, we started to see this rise above 1 in some regions of the province, particularly in the Fraser Health Region. We know that when we start to have transmission from multiple people to multiple people, it grows what we call exponentially. So that means if I pass it on to 2 people, each of them passes it on to 2 people. Very quickly, we get to 4, we get to 16, we get to 256 within 2 generations. So these are the things that we need to pay attention to now. While the numbers seem like they're reasonable, the fact that we're seeing an increase in the reproductive number means that we're not having those safe interactions as much as we need to be. We need to reduce the transmission events that are happening in our community. Once we start to see increases, they rise very quickly, and then we go back to playing catch up again. Because the long incubation period, 2 weeks, what we do today affects what's going to happen next week and the week after. So it's often, once we start to play catch-up, it takes much longer to get the numbers back down. We know it doesn't take much for this spread to get out of control, which is why everything that we do individually makes a difference collectively. If you have symptoms of COVID-19, you must stay home to stay away from others and arrange to get tested. For employers, If people who work for you are ill, you need to support them to stay home. This is important not just on an individual basis, but means that your business is protected as well. This is not just a Lower Mainland issue, and we've seen this before too, where it starts in the higher population areas, but we know that we still move for various reasons, and it can spread widely around the province very quickly. We have to remember that today's new cases are the result of our actions as long as 2 weeks ago. But what's more important is that what each of us does today is what is going to determine our future. The precautions we take today will define how we fare 2 weeks from now, and what we do makes a difference. We have seen that even small social gatherings can spread exponentially when people go from that small games night that you had together to spreading to schools, spreading to workplaces, spreading to other settings. We need to stay the course with keeping our numbers small, keeping our interactions with others safe. And that means staying away if we're ill, covering our mouth when we cough, keeping our safe distance, wearing our masks, and cleaning our hands. Continuing to follow our public health restrictions and guidance that we have right now is what will lead us into the spring, even as we get our vaccination programs back up and running at full speed once again. So this is a week that's near and dear to my heart. It is what's known as the Random Act of Kindness Week. And I implore all of you to remember this as we get through this phase of our pandemic together, and to remember that kindness is something that is infectious as well. And I remind you all to be kind, to be calm, and to be safe.